Hi, my name is Erica Hagen, and I'm going to be talking today about some work that I've done with Ground Truth Initiative and Map Kibera over the past year and a half, looking at second order impacts of COVID-19. So this is a project with support from the US Department of State and the MapGive project, and took place in several cities around the world. In Nairobi, we looked at the secondary impacts on Mathare and Kibera, two informal settlements. And primarily we were looking at the second order impacts of COVID on education, water, and sanitation. So second order impacts being whatever is not directly health related, but caused by the pandemic disruptions, lockdowns, curfews, any other measures that came out of the pandemic. So this is our Open Schools Kenya work, and we basically looked at updates, and we mapped schools in the slums, looking at how the pandemic had impacted the schools. So for example, this is all data from OpenStreetMap, which we have collected over the years. Here is Mathare, and the settlement in the area that we mapped here has 233 schools. So we specifically looked at informal or private, small private schools in Kenya. They are known as alternative basic education facilities. So the kinds of data that we already had on them often entailed a population, student population, the kind of the registration or owner of the school, and the building materials, so forth. So what we were looking at was the impact on these schools. So to do that, we looked at, we surveyed schools, and including the proprietors of schools. Questions including, has your school had to reduce staff and teachers? Have you been able to pay staff and teachers during the pandemic? Did your school use remote learning? So we did find that about 30% used remote learning or attempted to, but most did not. Has your school struggled to stay in business? The majority did say that it has struggled because these schools tend to rely on private pay. So as part of this schools tracking, we did create maps of where the schools had been forced to close permanently. So there were several. This is a Kibera look at different schools that were forced to close during the pandemic time period. One interesting detail you might note is that there was quite a bit of impact from a railway line demolition, which meant that it was widening the space to the sides of the tracks of the railway, so demolishing buildings on either side. That had a bigger impact, perhaps, or about a similar level of impact on closing schools in the pandemic, but both were very challenging. So I'd like to go to my colleague, Zach, just a minute, and we'll hear him talk a little bit about the experience.
So for the two exercises, that is what wash mapping and education mapping, we engage a team of, in Kibera we had a team of 10 that comprised of 5 men and 5 ladies. That's in regard to ensure that we had like gender balance in the team. These are youths that we've engaged before in other various activities, mapping exercises. So we just reach out to them and told them that we have this exercise that we are carrying out, and if they would be interested to join the team for this project. And so they showed up. We did some refresher training for them to just help them to understand what kind of information we were collecting, and just introducing them also to the survey form so they can understand what information that we are collecting. Then after the training, we engage them now in the data collection process. We also had like one volunteer who was interning with us, we had worked with her before in a previous mapping exercise in the counties. So she had joined us for an internship. So she was part of the team also. In Mathare, it was a bit different. We reached out to some of the volunteers that we had, but there were not so many. So we asked them to also identify like other youths from different organizations that would be interested to participate in this exercise. So we had like 3 volunteers that we've been working with in Mathare, and they reached out to other 7 volunteers to participate in the exercise. So in total we had like 10 again in Mathare, and to also ensure that we had gender balance in the team, we had 5 men and 5 ladies. So in total we had like 20 volunteers that participated in this exercise, both wash mapping and education mapping. For schools, one of the most interesting thing was we noticed that there was a huge number of dropouts. Like most of the students who were in the school before COVID didn't turn up, so we had like a major dropout of students from most of these schools for various reasons. So in some cases we learned that after most of the parents had lost their jobs due to COVID, they moved to the rural areas, and as a result most of them didn't come back. So that meant the students who were going to these schools didn't show up. There was also issue to do with domestic violence in the family, which in a way also affected the students. So there was a lot of cases of divorce and separation, and when the parents will separate, one of the parents will go with the child. So most of them didn't go back to the school that they were in. We also noticed that a lot of schools really struggled to stay in business. Most of them had to reduce classes because most of the classrooms that they use are rented out. So because they were not getting a lot of money coming in, so they had to like cut off some of the classes to just ensure that they stay in business. So that meant a lot of students were also now squeezing in some of those classes. And yeah, the other thing is in Kibera we noticed a lot of schools closed down. So we have like a number of schools that closed down due to COVID, and also there have been a lot of cases of road constructions in Kibera and also railway demolition that also that happened during that period of COVID, that's last year, and most schools were also affected by that. So we have like a number of schools that were closed down. In Mathare, it's different. We didn't experience any case of a school that was closed down due to COVID-19.
Great. So let's go back to the presentation. So another aspect of our work here was surveying lots and lots of parents. We had 1,271 surveys completed in the 2 settlements. So we got a really good sense of what some of the concerns were around our topics. For example, have you been able to pay school fees during the pandemic? Some said yes, some said, the majority said sometimes or no. Have you had to change jobs, reduce work hours, or stop working? The majority had some kind of requirement to stop working, reduce work hours. Particularly, we were asking whether they had to do this in order to care for children kept home. This is just a question kind of asking what general hardships had been brought on them by the pandemic in terms of financial, primarily, and the school closures. So school closures came unexpectedly. Having to take care of all duties was very expensive. Feeding came up a lot, that it was very difficult to feed the children when they were used to having school feeding programs and so forth. So now let's take a look at water. Let's go back to Zach.
The other differences that we noticed around wash mapping was that we still have, if you compare the two locations, you'll still find out that there are more water points or more wash facilities in Kibera compared to Mathare. This is because of also the size of the area. One interesting thing that we noted was there's a whole village in Mathare that we noticed that don't have like toilets within the household. So in these informal settlements we have toilets that are within compounds, so like a number of houses share one toilet, so we call them plot toilet. Then we have the public toilets that are most of the cases along the road where people pay to access these facilities. So in this village we realized they don't have these toilets within the homesteads. And from the survey that we conducted, we realized that they really faced like a hard time when the pandemic just had started, and the government had put some mitigation like curfews that was starting at 7 p.m. up to 5 p.m. So that meant because they don't have toilet within their homestead, that meant that they really struggled during the night. If anyone needed to access like a toilet facility, they couldn't. So that meant they had to wait until morning to now get access to the public toilets, where again they have to pay for. So that was like a very interesting thing that we noticed.
So in order to sort of track what was going on with the wash sector, we again looked at mapping both Kibera and Mathare, all of the water points, including whether they were highly functional, reliable, and so forth. We also did the individual surveys again. So questions like, did you require more water than usual during the pandemic? Yes, most 80% said yes. So, and then another 62% said they had difficulty in accessing enough water. So one feature of the pandemic is that there was sort of a recommendation that there would be more hand washing, more sanitizing, more cleaning in general for hygiene purposes. However, there was simultaneously in Nairobi shortages of access to water. So the demand for water was increasing, the supply was going down. So what we did was look at, again, this is all on OpenStreetMap as well, the status and the operationality of each water point. Here we have 588 visible, whether they were operational or available, had water supply sometimes, often, always or never. Then we looked at the different operator types to see how many were maybe provided by which type of sector, including government. And then we looked at the locations as well. You're not seeing it here, but we also looked at whether there was a cost associated and how much it was. And here you can see that after removing those that were non-operational or only sometimes or never had water, I'll go back, see. So there's a lot of water points, but if you remove the ones that are unreliable, you get quite a few less. And there were very few that were actually free of charge. And similarly, this is one of our toilet maps. So we looked at, the condition, for example, of these facilities. So now I'm going to play a video about the water situation.
Availability or lack of water in the slum has had different impact in the spread of COVID-19.
Time corona ilikuwa ngumu kupata maji cause unapata time au kubali kutoka nje kwenda faa na maji pia iko karibu.
Water is an essential commodity and one that has been vital in the fight against corona pandemic.
Kukosekana kwa maji ilichangia pakubwa sana kwa watu kupata corona. Cause unapata wase wengi walikuwa na hiyo haja kuosha mikono, lakini sasa kuna maji.
In Mathare and Kibera slums, residents had to stand the water dry spell that followed soon after the announcement of safety guidelines from the Ministry of Health.
during the COVID-19 pandemic, there's scarcity of water.
Pi watuomo to wanyiewo gi pesa. To samoro pigno ji riede, en pi achiel, joma chwako kong'o dware, wan bende wariedone, seche moko chopo manyaka ji gore pigni.
There was a scare of corona spreading within the slums of Kibera and Madare if the water shortage was not addressed in time.
We don't have the finances and the water is scarce. Yet the rules are saying that you have to wash your hands every day.
Samoro pi olal, skech onyalo lal kata week mangima. Koro ma in ge ot mathin no, ok inyal logo maler, gik moko ok nyal dhi maber.
How have the residents been dealing with the water challenge?
NMS kutoka mwaka jana wamekuwa kipaumbele sana kwa kusaidia watu wa Kibera na maji sana sana katika janga hili la corona.
Mapping of water points both in Kibera and Madare exposed several issues that the community had to deal with while trying to access water.
We were mapping all the water points within the various communities that we went to, that is Kibera and Madare. There are so many cartels around water. If you have like enough supply of water in your area, they are the ones who like take charge.
Kuna wale makartels ambao wanaenda wakikata maji, wao wanajinufaisha na watu wengine wanaumia.
Time yenye tulienda tukalilia chief tukamwambia hatuna maji, tuliona pipe ya maji ililetwa na maji ikaanza kuconnectiwa maji ikaanza kuingia.
Great. So again, what we were looking at really was the distribution of the facilities as well as their quality for both water and sanitation. And as far as some impacts, so in terms of the education information, the local officials have been highly involved. Policymakers can now better understand the impacts of the pandemic in terms of water, sanitation, and schools. And there is a stronger ability to advocate locally for policies to support the children in these informal areas, as well as policymakers can see whether there's uneven distribution patterns. Water in particular is not evenly distributed as far as even within each settlement. So there are issues that target certain parts of the settlement more than others. And of course, all of this data, as Zach mentioned, is gathered by residents of these two settlements for the most part. These are the youth that MAP Kibera works with primarily. And it's therefore has a very high level of reliability. Also, they're going around talking to their own neighbors. So it's not a group that has come in from outside of the settlement, for example, which might have potentially gathered less reliable survey responses for various reasons. So there's, a real need for this kind of information. And I think that OpenStreetMap is a great kind of place to have this kind of data. And I would welcome your questions and follow-ups. Thank you.